If you look at the pharmacological classification of antipsychotics, so basically antipsychotics are used primarily in the treatment of schizophrenia. So we have two types. One is first generation and the other is second generation. I'll talk about that later. In this video, I'm going to focus on first generation mainly. So first generation antipsychotics, they mainly act on dopamine receptors, especially dopamine type 2 receptor. To some extent D3 also. So they are classified into two: low potency first generation antipsychotics and high potency first generation antipsychotics. Low potency first generation antipsychotics, they usually have lesser affinity towards dopamine receptor. So they are less potent in reducing symptoms of schizophrenia, and at the same time the risk of extrapyramidal symptoms will also be low with these medications because they usually have low potency towards dopamine receptor. For example, mesoridazine, thioridazine, chlorpromazine, etc. But if you look at high potency first generation antipsychotics, they have more affinity towards dopamine type 2 receptor. So basically they are much more aggressive in reducing the symptoms of schizophrenia. That means their efficacy is good, but since they are blocking D2 receptor, the risk of extrapyramidal symptom will also be more. For example, haloperidol, penfluridol, etc.